evening, everyone. It's Dr. Jen or Dr. Baker from drjenmed.com. And today I will be discussing diabetes. How have you been under the quarantine? How are you doing? Have you been taking the words to heart in terms of ensuring that your mental health is good? So today, as promised, I'm going to talk about diabetes. Like, it's been a long day and I'm here. Praise God. All right. So diabetes, everybody knows, is when the sugar in your blood is high, the glucose. All right. Now, this is going to be a very important video. So if anybody you know has diabetes, is a diabetic or pre-diabetic, you might want to tag them or share this with them or comment or whatever. All right. So diabetes is when the blood sugar is high. All right. Today I'm going to talk about type 2 diabetes, the one that you tend to get as you get older, not the one that children get. Now, diabetes is usually seen in people who have a family history of it. They are maybe overweight, don't do much exercise, so then probably more sit down. If they're working a job, they're more sitting. Smoke, alcohol. Remember, we'll tell you about the high blood pressure and diabetes. Now, some of the symptoms, how a person might know them have diabetes, is that they are thirsty a lot. They pee a lot, they urinate a lot, they get hungry easy, right? And like, no matter how much them eat, them still hungry, right? They get tired very easily. Sometimes they gain weight so easy. People say, oh God, I just eat this little bit and I'm gaining weight. Some people, them skin start scratch them. Some of them, this is very important, especially women, they get recurrent yeast infections, right? Recurrent yeast infections. These are some of the earlier symptoms of diabetes. Like, if diabetes has gotten out of control, you'll get the worst, the complications, right? Which I'm not going there, but I'm just saying that for now, if you find that you're passing a lot of urine frequently, thirsty a lot, tired, maybe not concentrating so properly, and especially if it's in the family, you ought to check your blood sugar. All right. So we know about the symptoms. How is it diagnosed? How the doctor know to say, yes, this is diabetes? The symptoms is one set of criteria, but you have the test that you do at the lab, the blood test. Now, sometimes when you're at your doctor's office, they'll ask you to pee in a cup, and then they put a stick in there to check it. They call that a urine dipstick. And if the blood sugar is high, sometimes it starts to spill over into the urine. And if you're having a lot of sugar in the urine, it might suggest that you might be diabetic. But the accurate way of checking it is to check the blood sugar. Now, how the blood sugar is checked is like to allow is that they make you fast. So like, you don't eat nothing for the whole night, and the next morning you check your blood sugar. Another way it's checked is 2 hours after eating. All right. And then you can be checked at any random time, but to make the diagnosis of diabetes, you have to be higher than a certain amount. All right. Now, I'm not going to stress out nobody with numbers today, but suffice to say, if you have symptoms of diabetes and your blood sugar level is higher than what is to be expected, that's how you are diagnosed with diabetes. Now, I'm going to share something very important. Some people, their blood sugar, them go doctor every year, the blood sugar is normal or just a toops high, but it's not in the diabetic range. Please be careful. I'm going to talk about this later. Please remind me. So I'm going to talk about pre-diabetics. Very, very important. I could have do a whole video on just pre-diabetes, right? So I'm going to talk about pre-diabetics, and I'm going to talk about how the body, your blood sugar can be normal, and by next month, it go up. Why does that happen? I'm going to talk about that, all right? So I just want you to know, though, that at the lab, they check the fasting 2 hours after. And then there's another test they call the A1C that is used to see how well your body has controlled the blood sugar over a few months. All right? So those are the main tests. All right? Why am I telling you? Because, Dr. Jen advocates that you must know what's going on with your body. You should not just go to the doctor and the doctor have your file, your docket, and say, all right, the test them is all right. You must say, doc, what was my A1C? What was my fasting? You know, what are the results? You must understand it for yourself. It is your body. All right. Now, apart from the labs, your doctor will examine you, right? Why? To check the heart, right? To check the feet. And I will talk more about these things. Listen, target diabetic friends. Share this with the people with diabetes. This is going to be a powerful video, actually. The more I look at the plan I have here, it is awesome, right? This is information people need to know from last year, right? So the doctor will examine your feet, check your heart, and all of that good stuff, right? Now, and if any other tests are deemed necessary, you will be sent for it. For example, to check the eyes, to ECG to check the heart, blood test to check the kidneys, all of that, right? Now, I want to take this time to explain a little about diabetes. Let me put it on the paper so I can have my energy, right? Now, there is this gland in the body, an organ, it's called the pancreas, right? And its job is to secrete or to produce a hormone called insulin. You've heard of insulin. You hear about insulin injection, right? So that organ is supposed to do that. When does it do it? When the sugar goes high. As the sugar goes high, that organ says, okay, sugar is in the blood. I don't want too much sugar in this blood, so I'm going to secrete insulin to reduce the blood sugar back to normal. This is normal. All right? The problem occurs when your blood sugar is going so high, so often, that the pancreas is constantly working to bring down the blood sugar. You know, Granny say, you go to the well and one day the bottom of the bucket are going to drop out. Some story like that. It's something like that with the pancreas. It is constantly making this insulin because there's so much sugar, so often. Hi, Miss Reynolds. So often. And then the blood sugar, to try and bring the blood sugar down. Remember, I told you already in the video that the body tries its best to keep everything balanced and normal. This is called homeostasis. For those of you who did biology in school, remember that word? Homeostasis, to try and keep things level. Now, what happened is that there are some people whose body cannot manage no whole heap of sugar. Some people, them body don't make for this whole heap of sugar. And not only your body don't make for this whole heap of sugar so frequently. So, you wake up in the morning, you have tea and bread and this and that. Then mid morning, you go and buy a snack or you eat something sweetie or juice or whatever. So it's so frequent that the sugar is going up, and the pancreas is trying its best to keep the blood sugar normal. Why is the pancreas doing this? Because when the blood sugar is too high, it is damaging and toxic to every cell in the body. Let me repeat. Excessive blood sugar is toxic to every cell in the body, and it does its damage gradually. All right, very gradually. So your body, which is always trying to heal itself, remember you have how much trillions of cells that try to replace themselves to heal you, is trying its best to keep the blood sugar normal. But we are not cooperating with the body because every minute we are drink syrup. Every minute we are eat one biscuit, crackers, bread and cheese, every minute. So this poor pancreas is always secreting. Now, another point. Let me tell you something. People with diabetes, and this is a sign of pre-diabetes, so listen carefully. People will eat bun and cheese. Say 2 sandwich of bun and cheese. And half hour, 1 hour later, them hungry like them never eat a while ago. Why is that? Because they ate, the blood sugar shoot up, The pancreas secretes insulin to try and carry it down. And in so doing, it carry it down too low. So it's like the sugar went up and then down, whoops. And when the sugar drop low again, guess what? You're hungry again. And then what do? You go eat again. So this keeps happening over and over and over. This is one of the symptoms of pre-diabetes. These are the people who are not greedy, you know, are not craving, you know. But your biochemistry, the chemicals in your body, the hormones in your body, they are saying to you how you're eating is mashing up your body. Let me say that again. Are not greedy, This with my phone. Sorry about that. Right? Is not greedy, is not craving, Your body just cannot handle carbohydrates properly. You remember that word carbohydrates from school? If you don't know it, I'm going to teach you today. Because diabetics have to know about carbohydrates. You have to know. So let me give you an example. A person with pre-diabetes or diabetics and them type of people, when them can't eat one patty or 3 patty them have to eat. Them can't eat 1 cup of rice, 2 cup of rice. And you wonder how them eat so much dumpling, how them eat so much bread and still hungry. Because the blood sugar shoots up, the body takes it down with insulin, it drop low. And these are the people who, when them blood sugar low, them dizzy and weak and miserable and they can't function because the blood sugar is just fluctuating. This is the most important part of the video. This is what is happening. Pre-diabetes. You see all those people who when they eat, when they feel something another righties, but I don't want to say it and then Facebook ban me, right? That is a symptom. Those people, when you eat, you feel sluggish. And then you feel hungry again, like you have to eat. It is showing you that your body is not handling carbohydrates properly. Other little signs that your body not handling carbohydrates properly. If you start seeing neck back get darker. You ever notice that? That neck back getting darker? That is called acanthosis nigricans or something like that, right? Discoloration, right? Easy for tired, easy fatigue, especially when you eat. Some people notice it, you know, that when they eat, them feel tired. Or when them eat, it's like them feel dizzy or lightheaded. These are the subtle symptoms of pre-diabetic. You're not quite diabetic, but you're on your way to it. This is life-saving information. Tag your friend them if you think it will be helpful to them. Share it with them. This is how we prevent problems. All right? So I've explained how diabetes on a whole generally occurs. All right? We are taxing our pancreas too much. All right? So, can you see this? Yes. I'm going to turn it on the graph side, right? I'm going to show you. I'm going to draw on it. So this is the axis. Yes, I'm a natural teacher, right? So let's say this is your blood sugar. You just eat something, your blood sugar goes up. Right? Your body is going to try and bring it down. And then keep it level. You know, levelish. Right? With a diabetic, they shoot up very high, much higher than normal. Then the insulin is a whole heap of insulin make, so it go way down low. Then you start feel what they say hypo. And then you go eat again, it shoot up. So it's periodis. What your body would really want is to, you have little waves, but to generally keep it kind of level. Let me see if that shows better. To keep it kind of level. That is what your body would really want. Not this. Nothing crazy like this. Pardon me, I'm not a strict physiologist and this is not to scale and this is whatever. But you understand the principle, right? Good. All right. So that is what happens with diabetes. You see, once you know that, you know how to manage yourself. All right? Now, the problems with diabetes, of course, is that if the sugar is toxic to your eye, you could gradually get blind and you don't even realize that you're getting blind. You just say, boy, I look like I need to go eye doctor, you know, I need glasses. Or for some people, them just start to them foot, the color, them skin of the leg start look a little dark. It look a little shiny. Understand? So these are how these symptoms and problems tend to creep. The foot starts swell up and then you got doctor and you check it and say, sorry, I have kidney problem. This is why Dr. Jen is giving you this information, yeah? Prevent some problems. How about the year of prevention? 2020, the year of prevention, right? Now, there's another thing I want to say about diabetics. It is toxic to every cell. The immune system is full of cells. White blood cells, fighting cells. As such, because diabetes affects the fighting cells, they don't fight as well. Understand what I'm saying? So you hear about virus going around or this going around. People with diabetes, right? You have to control the blood sugar because excess blood sugar damages the fighting cells. I tell you every cell, but I'm pointing out the fighting cells. It damages the nerves. You hear people say them have nerve problem, them finger and them toe kind of feel them can step on a nail and don't even realize. Them shoes can drop off them foot and don't even realize them don't have on shoes. Things like that can happen. Yes. Yeah, man. So these are the complications. So now you know so much about diabetes, don't? You know a lot. You have no excuse. You can't say, boy, body never tell me. No, you know. So how do you treat it? Let's get to the treatment. Now, the first thing is, I know we don't like getting stick with a needle for checking the sugar, but the sugar needs to be checked, especially when you reach a certain age. I'm not telling you my age, I look young and fresh, yeah. But when you reach a certain age, yes, even me have to stick myself and check yourself. You have to check yourself. This, can you see this? This is a sugar machine, aka glucometer. You see it? Yes, good. Now, this one you would put, let me see if I have any strips with me. This one you would put the strip. This is the strip for the machine that would go in here to test the blood. It's just one little drop of blood that it will need. All right? This is the part that you stick yourself. That's my least favorite part of things, right? But yes, so if you are diabetic, you need to get one of these machines. And if you are Jamaican on the NHF and JADEP, I believe you can get one for free. So you have zero excuse. I mean, after all of this is done, get the machine to check yourself. Some people said, Doc, you know, I've been balancing my sugar, so I know I don't need to take my pills and blah, 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 blah. Check. Glucometer or sugar machine, whatever you want to call it. Good. All right. So let's get into the treatment, right? Now, I'm not saying exercise because, you know, I want to be cute, but exercise. You know what it does? It allows your body to respond better to its own insulin. It makes the muscles say, yeah, all right, insulin is here. Let me bring down the sugar. Good. That is what exercise does. Apart from the other good stuff for your heart and blood pressure, exercise directly influences how insulin works with the glucose and the muscles. Exercise is a part of the prescription. You don't have to do it and be the fittest person in the gym and killing out yourself. Just walk. Like literally, you have two legs. Walk. Right? Walk. Do I believe in the muscles, the weight training? Some push-ups, some squats, something. 15 minutes in the morning, maybe 15 minutes in the evening. Start at your level. Who you compete with, do it at your level. If you can only manage 5 minutes, do 5 minutes. 0 is better. 0 is worse than 5, right? But you have to exercise. It is part of the prescription if you're working with the plan, all right? Hydration, water. It's very easy for diabetics to have dehydration. It is even mild dehydration will send up the blood sugar. It's very easy for diabetics to get dehydrated. When diabetics get dehydrated, especially when they are sick or have flu or whatever, it make them sugar shoot up and then them get those complications, right? The ones that they end up in coma and in hospital. Hydration has to be like, like how you breathe air, you have to hydrate. When you're diabetic, you have to hydrate. Now, let us talk a little about the medicines that we doctors prescribe. All right. The most common one everybody know about is metformin, right? Metformin. Right. Metformin, right, is very, very popular. It's generally very safe, right? The biggest problem I see people have with it is that it can give you a little diarrhea. It can upset your stomach and all of that. It's true, right? But hear me out. What metformin does is it works out how the exercise would work. It helps your body to respond better to insulin. So it sensitizes the body to the work and the action of insulin. So if you've been prescribed metformin and you can manage it, please do take it, right? Am I saying it's forever and always? It depends on how your body responds to the plan you are on, because you are watching this video because you intend to do something about this, right? I have seen people who work on it and are able to reduce their medication with them doctor, under the doctor supervision. Diabetes is not a disease you play with. Let me just stop and say this. Diabetes is not a disease you play with. You hear what I said to you? It is a very progressive disease. Like, even if you're doing everything what you think is right, in 2020, in 2025, it still tends to get worse for no apparent reason. So that is why I'm saying with diabetes, it's better to be on top of it than you lagging behind. All right? So you have metformin, and you have those other ones that, like Dayanil and the like, that helps your pancreas to secrete more insulin. Now, the biggest problem with those pills is sometimes your blood sugar can drop too low. So them always tell diabetics to have something sweetie or sweet juice with them, just in case. All right? We'll get into a plan. Don't worry yourself. So I just explaining how the medication works. And then everybody know insulin. Insulin is the actual hormone that you inject yourself. Nobody wants to reach that level. Some people do. There are different types. You have the ones that act fast, and you have the long-acting ones like Lantus. We will get there. But these are the medications at our disposal. And basically what these medications are doing are either acting like the pancreas that I told you about, or helping your body to respond good to the insulin that the pancreas would have produced. Now, back to treatment now. Foot care. I remember back in the day when I used to work in the clinics. Foot care. People, if you cannot even afford pedicure and all of that, which I don't even like pedicure with diabetics, because some of the technicians, the manicurists, when them digging in the toe, please be careful. The nail fall, then them put the tweezer, the nipper. They put the nipper in the nail fall and introduce infection into the nail. That's how some people end up with infection, So I'm just saying, at your own home, you check your toes, you check your feet, you check between the toes. Is there any fungus between the toes? The nails look all right. The side of the nail there, so we call that the nail fold, it swell, any pus coming from it, any smell. Check your feet often, regularly. Check your foot bottom, any cuts, anything draining, because some people with diabetes may have nerve issues, so they don't feel it, as I said before. Foot care. Ingrown nail need for fix. Those things need attention. I am tired of seeing people having amputations. Amputations. So apart from the diabetes affecting the nerve, it affects the circulation. How could I not tell you that in the beginning? The circulation going to the toes. All right, these are gems I'm dropping. These are some gems. People, share it. Share it with your loved ones. These are things they have to know. And the biggest problem I see is that people get amputated, for example, a toe off come off or whatever. And them say, boy, I never know, I shoulda. You know, me never know there was. Knowledge is power. Now you know. And you cannot listen to a video one time or hear a doctor talk one time and think you will remember everything. Save the video so you can listen to it another time to remind yourself next year, 5 years from now. You understand what I say? Alright, so foot care. Infection prevention. People with diabetes, right? When you see people with flu and, coughing and them something there, don't make them talk up in your face. You understand what I say? You have to almost baby yourself because depending on what your blood sugar is doing, your immune system might not be so strong. With diabetics, they might get a urine infection, it turn into kidney infection. They might get a regular cold, it gone to the chest and turn pneumonia and bronchitis. You understand what I'm saying? So when you're diabetic, it is best to baby yourself in terms of infection prevention. Wash your hand properly. You understand? Your food, you're going to eat fruits, right? With skin on it, right? Wash the fruit properly. You have all heap of fly around the yard. Get rid of the fly. You don't want fly a pitch on your food. Things like that. I mean, it sounds basic to say, right? But these are the things that you need to know. Now, we get to the diet. Now, this is the part that I am, just pray for me. I just need a little more energy. But this is the part that I want. This is the core of my message. This is the core of my message. I am not a nutritionist, right? But as a doctor who has treated people for many years, this is what I've noticed. There are some people who cannot manage carbohydrates. What are carbohydrates? It is one of the food groups. This includes sugar and starches. What are some starches? This sounding like a science class now. What are some of the starches? Yam, potato, rice, bread, etc. Irish, dasheen, cocoa, dumpling, cornmeal, etc. What are some of the sugars? Sugar, syrup, juice, sweetie, etc., etc. People with pre-diabetes and diabetes are not able to manage sugar, starch, carbohydrates properly. Let me break it down. Say you have a back problem, say you have a little strain. And you can't manage to lift heavy boxes. Would you go lift up 2 bags of cement if you had a back issue? No, because you would say to yourself, boy, my back all right, but me don't want to push it. Me don't want to lift up something and I go strain. It's the same way you have to think with diabetes. I do not want to overdo carbohydrates because my body has a problem managing it. It has a weakness, it has a vulnerability managing carbohydrates. You have to get that in your head, in your cranium, through to your brain. Diabetics, pre-diabetics have a difficulty managing carbohydrates. For example, when I was in the clinics, I could tell when it was mango season. Everybody's sugar goes up. Doc, I just eat 2 Julie mango, I just 2 East Indian. But yes, it is a fruit and fruit has minerals and vitamins, blah, blah, blah. We know. But your body cannot manage sugar. And the sugar found in fruit is the fructose, right? So, what am I saying? And this is from my experience with my patients. My opinion is this. And I remember, I am what you want to call a concierge doctor. So I go to people, places and treat them. And I've seen people from all over the world. Like literally all over the world. Right? And let me tell you this. There are different ways different countries manage diabetes and diet. I see some countries that they say, oh, I'm allowing you this amount of carbs per day. And this is the amount of medicines you will take to match your carbs. Right? So some people actually eat up a certain amount of carbs to match their medication intake. All right? Some countries do it that way. This is my belief. Hear me out. Reduce your carb intake as much as possible. Here, point one. Reduce your carb intake as much as possible. At least for the first, I don't know how long, for that first phase until your body gets a chance to heal. For some people, doing this allows their body to heal. For some people, the pancreas done already burn out and there's a point of no return that they have to use insulin. But for those, especially the pre-diabetics, the mildly diabetics, the early diabetics, rest your pancreas, so to speak. Don't bother lift 2 bags of cement with your back. Don't bother put too much carbs on the body for the pancreas to have to be working so much. In other words, reduce your starch. Reduce. Now, you know why I'm stressing this? Because I've spoken with so many diabetics. I'm going to know if a Spanish or French I'm talking. And it's like, no matter how I say reduce, them take it to be a different way. But doc, it's just a teaspoon of sugar I put in the tea. Right? Or doc, I just one slice of bread. Right? I've heard it all. Let me tell you what works the best. Have your carbohydrates at one meal. These are my observations and recommendations. Have your carbohydrates at one meal. Why? Back to this. So that your blood sugar is not shooting up many times for the day. Your blood sugar will only make one spike for the day. One spike. Instead of 4 and 5 spikes each time. You understand what I'm saying? So, people have different fancy way them call this, which I observed this on my own for many years now. Eat your vegetables and some protein. You understand what I say? Salad, string bean and cabbage and pak chow. Eat your veggies. Eat some meat, right? Eat a little, not too much, you know. Eat your fish, your chicken, whatever, right? But you cannot be having dumpling, piece of yam, green banana. Then that is lunch. Then dinner now you're having 1 cup of rice. Breakfast, 1 slice of bread. And I know you're trying to cut the carbs, you know. That's the point I'm making. I know you're trying to cut the carbs. But the issue I have with it is that you keep having spikes. So you find that those patients, even if their blood sugar is controlled over years, over a few years, them start to have problems because the pancreas still having to overwork itself. So your best bet is to reduce your carbs. And if you have to have your carbs, you know, a good amount of carbs, have it at one meal. So if you choose to have your carbs at lunch or dinner, that's where you choose to have your carbs. Right? Have it at one meal. All right. Now, the other thing, not all carbs are created equal. Carbs are not created equal. Carbohydrates. You have some carbohydrates, right, that send up your blood sugar much quicker. For example, if you eat a slice of bread right now or drink a cup of juice, your sugar goes zoops. But if you eat something like sweet potato, the sugar don't go up so quickly. It goes up more gradually. They call those complex carbohydrates. Those are the type of carbohydrates that it would be best to eat. Right? White rum. Well, the white rum makes good hand sanitizer, right? But yes, liquor is straight sugar. Liquor is straight sugar. I mean, liquor have other purposes, you know, because I see, let me not tell you my opinion on white rum. But the point I'm making, right, is that some carbohydrates send up your sugar really quick. Those stuff. This is referred to as a glycemic index. Go and Google it. I'm going to put it in the comments when I'm done. Glycemic index of food. So you want stuff that have low glycemic index, meaning they don't quickly turn to sugar when you eat it. All right? How do you know? Let me tell you how you can know that a food is really not good for you. If you eat a slice of bread, right? And after you eat the slice, you still feel hungry. You feel like you could have eaten more and more and more. Not good for you. Understand? When you eat even sweet potato or, something brown rice or something like that, you find that it is more filling and that you don't feel like you're going to eat whole of it. But this is my Dr. Jen opinion. I do not replace your doctor. I cannot, because I don't know you and your whatever. But this is what I found. Limit your carbohydrates, right? Each day. Some people call it low carb. I'm not saying you have to go extremely low carb, but most importantly, apart from limiting, is try to eat your carbs at one meal. Try it. I've actually put patients on that, and those who comply with that, I've had to significantly, in the past, reduce how much medication they take. It literally reduces your blood sugar, like literally, because you're not having those spikes. All right? Good. So see, I share a gem with you, See, I share something that you can try and tell me. You can come back and tell me how it works. Like do it for about 2 weeks and tell me how it's working for you. I mean, it won't work for everybody. There's no magic pill, no magic potion. But it can't hurt. It cannot hurt. So I want you to have a lot of veg. A lot of veg. And what you're going to find when you do it properly, is that your appetite going to reduce. Your appetite going to cut. And you're going to wonder, how come I'm not so hungry? Why? But you already know, because I taught you. Right? Good. Now, the other thing I want to say about the diet, because this video is kind of getting too long, right? Is some people think they're eating the right foods, but sometimes they are hidden carbohydrates, hidden sugars in the food, right? Hidden. Let me give you an example. Barbecue sauce, ketchup, and them something there. You're eating it and you think, well, it's tomato, It's full of sugar. This is my perfect one. And don't get me wrong, I love Wisinko, but cran water. People say, dog, it's just cran water I drink, I don't drink nothing else, And them say, oh, I look at the bottle, the back of it. This is chubby. Don't worry yourself. It's not mine. Right? But you look at the back, the labels, right? Where it have the nutrition information, right? And then people say, oh, the cran water say it only have, I don't remember, so I don't have a cran water in front of me, but it might say, oh, it only have 12 grams of sugar. It's not so much. But what people don't understand about reading food labels is that it is that amount of sugar per serving. Per serving. So you, for example, now, let me see this chubby, for example. This chubby has, OMG, 25 grams. This little backlash chubby. 25 grams of sugar. All right? In this little bottle of chubby. Right? When most people probably don't even need more than, say, 100 grams for the day. Right? I don't want to get into numbers too much and confuse it. But the point I'm making is that this is just a concentrated version of sugar. I'm not advertising for people, but this is some cream crackers, right? Doc, I just come to bed and eat a couple crackers and tea. That's why I'm finding this to show you, right? All right, so see here, I'm looking at the nutrition information, okay? And this one says servings per contain about 4. Total carbohydrates, 23 grams. Wow, okay. Total sugar, 2 grams. So, 1/4 of this cream crackers, I don't know how much come in there, right? Has 23 grams of carbohydrates. So when you eat a bag of this, or half bag, you just say, Doc, I don't eat much, it's just some crackers and tea I eat and go to my bed. People forever say that. Not true. Just some crackers and tea and go on my bed. You are eating sugar, carbohydrates. So you have to understand. I want people to go and Google and research which foods have starch, which foods have sugar, and avoid them. Avoid them, at least until your blood sugar is more controlled. There are other ways to get the good types of carbohydrates, right? You can get them from your veggies. And in Jamaica, we are blessed because we have so much veggies. And if you do miss your little carbs, have it at one meal. Have it at lunch or dinner. So you want a 2-finger banana. You want a cup of rice. Have it at one meal. So what I'm saying in a nutshell is exercise, drink your fluids. You can eat, but be careful with your choices. And the hallmark of you having better control of your blood sugar is that, wow, I'm sweating, is that your appetite will be reduced, and that's how you know your blood sugar is staying level. You are not stressing out the pancreas as much, and you're on your way to healing. The last point I want to make before I go. There are some people who they'll go to their doctor and their blood sugar, them test it, and it's normal. And them say, oh, my sugar is good and I'm fine. Your sugar, I just want to say this, and people don't know these things, so that's why I say it. Your sugar can be normal, right? And your pancreas is not. Your insulin is not. And then now, a month later, 2 months later, boom, some big old problem, Your sugar gone up high, you end up in a coma, you end up with this, that, all kind of problem, right? But you say, but just 2 months ago, I checked my sugar. Your sugar can be normal, but there is a problem with what the pancreas and insulin is doing. You understand? These are pre-diabetic people, like a ticking time bomb waiting to explode. So, even though the numbers for the blood sugar is reassuring, that's not the full picture. The diet, what you're putting in your mouth, too much carbohydrates, how it's affecting your body is the most crucial. So those people who I explained already, those pre-diabetic people, right? And people who have certain hormonal conditions. I know a lot of women have polycystic ovaries. I don't know if you've ever heard of that. They have what they call metabolic syndrome or syndrome X. So you have all of these people who their body really cannot handle carbs properly. But one of the ways that you can improve that is exercise. Yeah? Now, as to supplements and stuff that can help, there are a lot of supplements and a lot of bush and, studied in scientific studies. And a lot of them do work. That is true, right? But again, they work at the level of reducing the blood sugar. You have to do your part with what you eat. And to close, a very important close. I don't know. Maybe you're going to have to write it on my tombstone and say I'm the doctor who stressed that there's a big link between stress and disease. Stress, right? Stress. And this is definite observation. You see, when you're stressed out, your blood sugar goes up. Even people who are not diabetics, when they're stressed out, then blood sugar goes up, right? So the point I want to make is that stress and diabetes, they do not mix. They do not mix, right? Chronic stress is damaging to your cells. Diabetes is damaging to your cells. And together, that is the recipe for a perfect volcano. So what am I saying, right? In a nutshell, people with diabetes, I give you a whole heap of information. I wonder if I give too much information today. Get a notepad, write down a few of the things that you can start to implement. When nobody coming to stress you out our situation, say no thank you. No thank you. I do not want the stress. I don't want the drama. I don't want it. No thanks. You yourself, put yourself in drama problems, right? Eat properly. Go and research carbohydrates. Stop eating the carbohydrates. It's breakfast, lunch, and dinner. Try and eat it at one meal. And the carbohydrates you are to eat throughout the day are from your veggies. All right? Have a little meat, you can have your pear, you can have all of that, but you cannot be having tea with sugar and juice with dinner and this, and even coconut waters are hidden. You have to be careful. Diabetics have to be careful with coconut water, sugar in there. You have to be careful. fruits, the sweet fruits. So you have to know how to handle yourself. I've given you a lot of information today. To my point that I forgot to drink some water now. So I know a lot going on in our country. It's hard to not stress out, but I've shared a video. I've done a video about dealing with depression and grief. Watch it as many times as you need it to fortify your mind. This video is to help to fortify your body. If you want consultations with me, I'm available, drjenmed.com, via Skype or WhatsApp. We can do it that way. So you can send a message and we set up appointments, etc. Yes, I do all of that. But in the meantime, I give you all of this information for you to work your own little plan. Take care of your body, man. We don't know how long this quarantine going to be. We don't know if we're going to have a lockdown. We don't know. So take the information I say and do what you need to do. You understand? Anyway, I am going to leave now. I have to go and do dinner. So until next time, you can tell me which other topic you'd like me to talk on. If you have any questions, you can put it here, comment here. I've been doing question and answer. And until next time, God bless. Remember, if this has been helpful, don't be mean. Share it and take care. Bye.